Hi, my name is Dr. Meredith Grossman. I am a pediatrician at Mount Sinai Pediatrics, which is part of Mount Sinai Doctors' faculty practice. We know that the COVID-19 pandemic has caused a tremendous amount of anxiety and uncertainty, and that many parents may have questions related to their children's health and well-being regarding the virus. I will attempt to answer some common questions and concerns. The first question that many parents have is, if my child becomes infected with COVID-19, will he or she be in danger? While there have been rare cases of infants and children with severe illness due to COVID-19, early research suggests that children do not seem to be at as high a risk for severe illness compared to adults. Those at higher risk include older adults and people with chronic underlying medical conditions, including heart disease, diabetes, lung disease, and suppressed immune systems. So the next logical question would be that although the virus isn't seen in children as frequently, how can I prevent my child from getting the virus? Here are a few ways you can help to protect yourself and your children from COVID-19. Number 1, hand washing. Wash your hands frequently with either soap and water or hand sanitizer with at least 60% alcohol. It is important to wash for at least 20 seconds. 20 seconds may seem like a long time to a child, so sometimes it is helpful to sing a song while they are washing. For example, sing the ABCs and tell them that they must keep washing until the song is over. Number 2, practice social distancing. This means that you should stay at home as much as possible and put space of at least 6 feet between yourself and others. If you need to leave your home for essential errands, the Centers for Disease Control and Prevention, or CDC, recommends wearing a cloth face covering. Number 3, encourage your children to cough or sneeze into a tissue if one is available. If a tissue isn't available, cough or sneeze into an arm or elbow, not a hand. Number 4, avoid touching your face and teach your children to do the same. Another question many parents have is, if my child has COVID-19 and/or I suspect that my child has the virus, when should I seek medical attention? If your child is struggling to breathe, has persistently high fevers, and/or is lethargic, you should seek medical attention immediately. Finally, another common concern parents have is about bringing their children to the pediatrician's office because they don't want to unnecessarily expose them to the virus. Most pediatricians, based on guidelines from the American Academy of Pediatrics, or AAP, have altered their office schedules and operations to adjust to the COVID-19 pandemic. These alterations take into consideration the benefit of attending a well visit and receiving vaccinations with the risk of exposure. The AAP recommends that pediatricians continue to see newborns, infants, and younger children who need immunizations. Older children and adolescents are encouraged to reschedule their visits to a later date. Pediatricians are also encouraged to limit well visits to the morning and see sick visits later in the day, and designate specific rooms or areas to well versus sick children. Additionally, many pediatricians are now delivering care via telehealth. If you have specific questions about your child's upcoming appointment, we suggest that you reach out to your provider. If you would like more information about COVID-19, we suggest visiting either www.cdc.gov or www.cdc.gov. www.healthychildren.org. And if you want to schedule an appointment with one of our pediatricians at Mount Sinai Doctors Faculty Practice Associates, please call 212-241-4242. Thank you and be well.